First, let's welcome Vicki Morton, Director of Clinical and Quality Outcomes with Novant Health Brunswick Medical Center's Anesthesiology Group. Welcome, Vicki. Thank you so much for being here today.
Thank you for having me.
Now, I understand that you're with Providence Anesthesia Associates, and that's the anesthesia provider for Novant Health Brunswick Medical Center, correct?
That is correct.
And so tell us a little bit about the group and your role within the group.
Sure. So Providence Anesthesiology Associates is based in Charlotte, and they have approximately 70 anesthesiologists.
Wow.
We started providing anesthesia care to Presbyterian Medical Center back in 1991 and have been a partner with Novant Health since its inception. My role as the Director of Clinical and Quality Outcomes and a nurse practitioner is really to work with the group and making sure that we're providing the best evidence-based medicine and best possible care to our patients. With that, we do have a large program that we partner with Novant on called Enhanced Recovery After Surgery, and my role with that is to oversee it, implement in various hospitals, expand the program, and making sure that it's running smoothly.
Well, let's back up just a little bit. You mentioned that you're a nurse practitioner. So tell me about your background. How did you and when did you become a nurse practitioner?
So I was a bedside nurse in critical care areas for several years, various ICUs, medical, surgical, cardiac care, trauma. And I left the bedside to enter into organ procurement, and I worked with organ donors and their families for several years, and then decided to go back to school. I went and got my doctorate of nursing practice and nurse practitioner a couple of years ago, and while doing that was working for a medical device company called Edwards Life Sciences and was one of their clinical educators. I did a lot of work with various facilities around the area, helping them to implement their enhanced recovery programs and various elements of that. And then I also did my dissertation in enhanced recovery in a very large surgery called Whipple that is very complex, and I chose that, and I'm so passionate about ERAS because I have a family member who went through that many years ago and did not fare well, had a lot of complications, had a subsequent kidney transplant, and I just thought there had to be a better way.
So we're here today to talk about the Enhanced Recovery After Surgery program. So let's start with the basics, first of all. What does that mean?
In a nutshell, Enhanced Recovery After Surgery, or ERAS, reduces the surgical stress response, which improves clinical outcomes.
Okay, and I understand that this new program will be available to colorectal surgery patients initially. Is that correct?
Initially, that is correct, and I believe we have our first patient coming through the first week in May.
I see. And tell me about the experience. How will that differ for these patients?
Sure. So with Enhanced Recovery, one of our main goals is to make the patient a partner with their own care. We very much involve them, and that starts with patient education, extensive patient education before surgery, where we give them instructions on what they need to be doing leading up to surgery to help improve their post-operative outcomes, as well as doing things like giving them carb-loading drinks to take the night before surgery, the morning of surgery, allowing them to drink clear liquids up until just a few hours before surgery.
Really? Well, that's a change.
It is a big change, big change. And then also allowing them to eat very quickly after surgery, getting them up, mobilizing them very quickly after surgery, giving them things like multimodal analgesia to help reduce the need for opioids to treat pain, because we're treating them with this multimodal approach, as well as elements such as preventing postoperative nausea, vomiting. So it's a very multifaceted pathway.
Okay, though the care team at the hospital, then, they have specific actions that they do once the patient has been admitted to the hospital. Is that correct?
That is
And
correct.
how would that change their normal routine? How would it be different?
Well, with this pathway, every surgeon who is involved with each patient, everybody does the same thing every time.
Right.
They all have their checklists, if you will, in every care area. So the pre-op nurses know exactly what they need to be doing, all the way through to the floor. And so It changes in the sense that it is just a little bit of a different approach with
Okay.
the ERAS patients, and so we give guidelines in which the care providers follow to make it a little bit easier.
And did this program require special training or education for the physicians as well as the nurses?
So all of the clinicians went through an education
I see.
that they learned the how, the why, the what behind enhanced recovery, why Novant was invested in doing this. And so once they go through that education, then they also learn all of the protocols and the elements that are involved. And it's essentially, we're changing a culture here.
Right.
We're changing an entire approach to surgery. So we're challenging the status quo with this program. What used to be done for surgery and how patients used to go into surgery is very different now. So they do go through a lot of education and follow-up and continued education.
Well, this sounds like an amazing service for patients. So we're about out of time, but is there anything else that you would like to share with our viewers before we wrap up?
Yes, so the program with Novant started back in May of 2016, a great partnership with the anesthesia group, Providence Anesthesiology, and hospital leadership, and then our surgical partners. With the program and since the start, we have been able to reduce the length of stay, reduce complication rates, and patients are just overall more satisfied. They're much more satisfied. So we're going to continue to work towards this, partner with Novant. We very much feel that working with our hospital partners and the care team is a great approach to the best patient care that we can offer.
Right. Well, again, thank you so much for being here today, Vicki. This has been a great experience, and I look forward to hearing how it goes with the first few patients.
Thank you very much.
You're welcome.